respected teachers and all my dear friends. Today I am going to present a short seminar on the importance of algorithm. Now first we will look at what is algorithm. It is a step-by-step method of solving a problem or making decisions while choosing among multiple alternative options which are linked to each other by a decision tree, as in making a diagnosis. And then what are the characteristics of the algorithm? Algorithm has the following characteristics. First is finiteness, that is, the total number of the steps used in the algorithm should be finite. Second is the definiteness, that is, each step of the algorithm must be clear and unambiguous. Third is the effectiveness, that is, every step must be basic and essential. Usually, algorithm has an input and an output. Like in the case of the medical field, it has input in the form of the symptoms and the signs, and then we apply the algorithm and outcome comes in the form of the diagnosis, and it helps in the management and the treatment of the patients. Then what is the format of the algorithm? The patient presents with us the symptoms and the problems. We assess the patient and we go for the diagnostic studies. Either these studies are positive or these may be negative. If they are positive, then then on the basis of these studies we see the intervention and the treatment. If these studies are negative, then we recommend for the additional assessment and diagnostic studies. Then we go for the intervention and the treatment of the patient. Then what is the application of the algorithm in the medicine? First and most important is the identification of the diseases, that it helps in making the diagnosis. Second is the severity of the disease and condition of the patient. And third is the management and the treatment. And what are the advantages of the algorithm? It removes the subject bias of the doctor and healthcare worker because there is a standard protocol. Secondly, it systematically helps us to reaching a diagnosis. And then third is it creates a uniformity. It saves time in case of emergencies and facilitates rapid decision making. It is concise and easy to remember. And last is the approachable even to the Anganwadi worker and the ASHA. Like in the case of the IMNCI, they can categorize the patient into the three categories, like whether they have to refer to the patient or they can give the home-based treatment, or whether they can be treated by the ASHA or the Anganwadi worker. Now, what are the disadvantages of the algorithm? Then the important disadvantage is that common diseases with the uncommon presentation can be missed. Second is that it does not include underlying rationale or concept. That is, there is lack of thorough knowledge, and it is difficult to understand and remember unless we go through the literature thoroughly. Thank you.